Dr. Baubac, how many grafts do you typically harvest in one session? Sort of what's the average, and then what's the sort of the upper range of that?
The graft range really depends on what the patient's requirements are. Some patients need a smaller procedure. We do what's referred to as an executive case for those whom cannot shave their scalp, and those we typically limit to about 1,200 grafts, and they can have the procedure with FUE harvesting and return to work within 3-4 days.
Okay.
There is a second manner in which we approach the case, and that's where we can leave the hair on top long and buzz the sides. And that we limit to about 2,200, mostly because when you go higher, it becomes tougher to conceal that level of trauma with the dense packing that we do. The third is a shaving session, and those we have gone as high as in the 6,000 range.
So in that case, you'll shave everything and just...
We'll shave the donor region, we will shave, and when I say shave, we clip it very short.
Right.
It can't be completely shaved.
Right, of course. Yeah.
And those we have gone as high as in the 6,000 range. Our average generally is between 3,000 to 3,200 grafts. That's where we feel most folks' needs are. There are circumstances where patients do want to have a very large session, and we have done that. And so those are where our ranges lie. Now, densities do differ based on origin. For example, patients from Northwestern Europe, they have finer hair.
Right.
And so their follicular density could be as high as 100 to 110 follicular units per centimeter squared. And you have to consider that when you're restoring the front.
Right.
Because if it is anything less than what they already have, even if you go up to 75, you're still short 30 follicular units per centimeter squared.
Right.
You're still thin 30 follicular units per centimeter squared in that region comparatively. So these are the intricacies you really have to look at when you're determining graft count. Most important, you have to know that your donor region is finite.
Right.
Do not waste it. You know, use every graft judiciously, and it is permanent. So where the hairline begins is a real key consideration, because hairlines can always be brought down. Once they're down, they are permanent.
Do you offer PRP?
We at our Beverly Hills clinic do a significant amount of PRP.
In conjunction with surgery and separate, or just surgery?
Both, as an adjunct therapy, mutually exclusive and independent of the procedure, which we found as a great tool in the armamentarium of patients that may not want to use minoxidil daily.
Right.
They would probably need, at least with our protocol, every 12 to 18 months, this type of therapy. And we also do use PRP with the procedure, and what that has allowed us to do is reduce our post-operative time in terms of minimizing patients' activities from 28 days to 14 days. And now we can get patients back to their regular lives much more quicker. And in addition to that, we've seen results come in as early as 8 weeks.
Wow. Which
always brings a smile to our patient's face, as does mine. And the final result with PRP usually culminates in about 12 to 14 months, whereas without PRP we've seen results take all the way up to 18 to 20 months to come in. And so both are options. I feel it's a lot about communicating. Every case is individualized, every case is different, and I think getting to know the patient as best as you can, and that's through the consultative process, pre-operative phase, and assisting them post-operatively, because the post-operative phase is really critical.
So I think we've covered some good ground. There's a lot for, I think, people to think about and digest when they're deciding what to do about something as sensitive as dealing with their hair loss. What would you say to that person who maybe is just watching this interview and is thinking about doing something and has learned a little bit from this interview and maybe is considering it to do a procedure? What would you tell them to do? Where would you tell them to go, and how would you tell them to start? How much research should they do before they make a decision?
I have 3 advice for them. Take your time, be patient, do as much research as you can. Can't do enough. I guess a 4th one would be knock on as many doors as possible. Speak to as many surgeons, as many clinics as you can. You'll find the right answer for you, and when that answer comes, you'll know it.
Okay, well, thank you very much for taking the time to do this interview. It's very informative, and it has been an absolute pleasure for me.
Thank you for having me. It's been my pleasure.